September is Prostate Cancer Awareness Month. This morning we have Dr. Paul Scott with Urology Associates of Mobile with some important information on prostate cancer. We're also going to tell you about a free screenings coming up, so lots to talk about. First, Dr. Scott, tell the folks a little bit about what is prostate cancer.
Well, prostate cancer is only found in men. It is the second leading cause of cancer death in men after lung cancer. 1 in 6 men during their lifetime will be diagnosed with prostate cancer.
That number is staggering, 1 in 6 men. So it's important to be knowledgeable of prostate cancer, and even more important to get some screenings for prostate cancer. And that's what we're talking about this morning. Next Friday, there's a big event coming up where folks can come on out and get free screenings. Tell us what's going on.
That's correct. The most important thing about cancer is detecting it early, because you have more options for treatment if it's caught early. The best way to catch cancer early is to go through screening before you have symptoms. And so this coming up Friday, September the 20th, there is a prostate cancer screening being sponsored by Infirmary Health and the Diagnostic Medical Clinic, where they'll be drawing blood. They'll be drawing a PSA test, which is the screening blood test for prostate cancer.
How long does that test take? Is it a long process to get tested, or pretty quick and painless?
Very quick. Quick blood draw, and they'll be in and out. It's free to the first 100 men. They're doing it between 8:30 and 10:30 at 3 different locations here at the Fox 10 studios, and at North Baldwin Infirmary, and at Thomas Hospital at the fitness centers at those 2 places.
Yeah, we teamed up with you guys to do this because we know how important it is. So you mentioned those 3 locations for folks to come on out and get those screenings. Is there a certain age that people should start looking into this, or when should we start getting these screenings?
That's a very important question, and that's changing recently. The good thing about the PSA test is that it's so good that we worry that we're catching too many cases of prostate cancer that would not be clinically significant.
Wow.
So basically, people who are under the age of 40 don't have any reason to be screened. People who are between the ages of 40 and 55 who have a family history of prostate cancer, are African American, or have symptoms should be screened. And essentially between 55 and 70, you should have a yearly screening.
So starting, though, as young as 40, coming out and get screened. So we mentioned there are 3 locations. We're going to have a lot more information about this on our website for you to find all the information about where to go and when. But again, that is next Friday between 8:30 and 10:30, we said, right? All right, in Fairhope at Thomas Hospital, the North Baldwin Infirmary, and also right here at Fox 10. So we strongly encourage you to come on out. Is there anything else the folks should know, or did we basically cover it?
It's just important that everybody be screened. It's easy to do, and it gives you more options if cancer is caught early. That's the most important thing to know.
Early detection is the key. Come on out next Friday and get screened. Thank you so much for coming in.
Thank you.
All right, Cherish.